Omicron could infect 50% of Europeans in next 2 months, says WHO. A west-to-east tidal wave of Omicron infections risks submerging health systems across Europe, the World Health Organization has said, warning that more than half the region's population will be infected with the variant in the next 2 months. Hans Kluge, the WHO's Europe director, said the region had recorded more than 7 meters new cases in the first week of 2022, double the rate a fortnight previously, with more than 1% of the population catching COVID-19 each week in 26 countries. Kluge said the variant had been reported in 50 of the Europe region's 53 states and was becoming dominant in Western Europe. At this rate, more than 50% of the population in the region will be infected with Omicron in the next 6 to 8 weeks, he said, a scale of transmission he described as unprecedented. Its impact would be deadliest where vaccination rates were lower, such as in Central and Eastern Europe, Kluge predicted, saying he was deeply concerned that as Omicron moved east, deeply concerned. In Denmark, he said, where Omicron cases had exploded in recent weeks, the COVID-19 hospitalization rate for unvaccinated patients during Christmas week had been 6 times higher than for those who were fully vaccinated. He said, while vaccines provided good protection against severe disease and death, rising hospital admissions were good protection. Kluge said countries not yet hit by the Omicron surge had a closing window of opportunity to act now by protecting their most vulnerable citizens, as well as doing their utmost to ensure healthcare and other key workers could keep services running. Governments in these countries should mandate high-quality masks in all closed and indoor spaces and ensure full vaccine series and booster doses were given as early as possible, especially in the health and essential services sectors, he said. Where the Omicron surge has begun, the priority should be to avoid and reduce harm among the vulnerable, and minimize disruption to health systems and essential services, Kluge said. This means prioritizing vulnerable people for primary course and booster doses, advising them to avoid closed, crowded spaces, and offering the possibility to work remotely wherever possible until the infection surge passes. PCR testing should be prioritized for individuals at risk of severe disease and critical workers, he said, and rapid tests should be deployed more widely, again prioritizing contacts at high risk of infection and at high risk of severe outcome. After moves by several European governments to shorten isolation and quarantine periods to prevent economies grinding to a halt, Kluge said such decisions should be taken only when essential to preserve critical service continuity. Shorter isolation and quarantine times should also be conditional on negative tests, he said, adding that in general all such decisions must be taken with careful weighing of the risks and benefits of doing so. Keeping schools open had important benefits for children's mental, social and educational well-being, he said, urging governments to review protocols on testing, isolation and quarantine of classroom contacts to minimize disruption to learning. However, he said Omicron's greater transmissibility meant authorities should prepare for a mix of online learning and in-class attendance.